Yeah, the national booking service went live this morning. I've had a look at it this morning, and many people have tried to make bookings, but there do appear to be some early problems with the booking service. Most of the GP clinics that are listed say that they're taking phone bookings only. So GPs' surgeries are being absolutely inundated with phone calls from patients wondering when they can get the vaccine. They're in a difficult position because they're not actually being allocated much vaccine initially. Lots of GP surgeries are only receiving about 50 doses in the first weeks of the vaccination rollout. That's expected to ramp up as this local production from CSL comes online. But the ability to make online bookings doesn't seem to be there despite this national booking service being launched. So people are quite confused, I think, at this stage as to how they can actually get in to see their GP. And of course, it's only the people in the 1B rollout who are actually able to make appointments, and most of them are not able to make appointments because of lack of supply. So in the 1B, you've got elderly people aged over 70, but I think the over 80s are being prioritised first, people with an underlying health condition, and some of those high-risk workers, including police and emergency services, meat processing workers, etc. But certainly it does seem to be quite a confusing process for a lot of people so far.
Yeah, it sounds like there might be a bit of scrambling going on behind the scenes to hopefully fix some of that up ASAP. Natasha, when it comes to the warnings we're seeing from overseas about AstraZeneca, we know here in Australia, our health authorities, our government, everyone's working very hard to convince Australians that the concerns about blood clotting and the AstraZeneca vaccine are unfounded. But a lot of people reading these headlines are saying, well, why are health authorities in other countries coming to such a different conclusion?
Yeah, that's right. It is concerning for a lot of people. I've spoken to the AMA this morning, who said that at this stage they're not getting feedback from people that this has made them less inclined to get the vaccine. Hopefully Australia can rest on its record in vaccine administration, which shows that people really are very willing to receive vaccines. But I think this situation in Europe, as you say, that is the question that's on a lot of people's minds. Why have so many European nations suspended the administration of the vaccine? I think what needs to be kept in mind is that the European Medicines Agency has not said that the suspension is necessary. They're quite adamant that the vaccine is safe and it should begin to be administered. It should continue to be administered. It's just that these European countries are not following the advice of their own regulator. So I think that it's really quite baffling. Nobody seems to have an explanation as to why they're going in this direction other than a real overabundance of caution. But it certainly is not positive news for Europe's rollout of vaccines. They're already running so far behind schedule. There's already a lot of indications in many European countries that people are reluctant to get vaccines, in particular the AstraZeneca vaccine. So this is really going to jeopardise their entire vaccination project, and it really is concerning for the whole world, because if some countries aren't protected, we're all not protected. So I think that they're going to have to do a lot of work reassuring people when inevitably they do start the rollout up again as to why they've now deemed that the vaccine is safe.